This is an ultrasound study of a 55 years old male. Here you are seeing the urinary bladder. This is the urinary bladder in transverse section. And when I move the probe downwards, here I see a moustache-shaped structure with clear boundaries, and this is the moustache, or in fact not a moustache shaped like a moustache. It is seminal vesicle. Its outer surface is normal, and its posterior surface is clearly seen is normal. So the seminal vesicle in transverse section is normal. The urinary bladder is normal. Seminal vesicle is normal. Now when I go further downwards for the prostate, here you see, this is the prostate gland. Okay. And what you are seeing is there are two focal lesions within the prostate. This is the prostate in transverse section. This encircled area is the prostate in transverse section, and within it, on the left side, you see two cystic areas, hypoechoic areas, rather measuring. Now this one measures 28.3 into 28.7 centimeters, and on the right side, the right lobe, it measures 29 into 25 centimeters. So these are the dimensions. Once again, right in this direction, 25 millimeters into 28 millimeters. Right one is 26 millimeters into. So measuring in any direction, you get the right measures 25 into 28, the left measures 25 into 28, the right measures 26 into 28 millimeters. Now, this is all of this is the prostate gland in transverse section. This is the transverse section, this being the urinary bladder. Now note the outer surface of this focal lesion in the left lobe is well demarcated. That of the right lobe is also very well demarcated. These are hypoechoic, totally hypoechoic. This is also hypoechoic, and there is a tiny echogenicity seen at the posterior margin of the left focal lesion. The another point to note is that there is no posterior wall enhancement, no acoustic enhancement is seen posterior to these hypoechoic areas. So they can internally thick echoes are seen filling this area. So maybe this is a thick echogenic material within these focal lesions that is preventing the posterior wall enhancement, and you can see the posterior wall very clearly. So without any history, I don't have any history, I don't have any lab investigations, I don't have any other investigative procedures with me, but the patient gives the history of dysuria and is unable to pass the urine completely, is the only history that is with me. So keeping the history and the appearance of the focal lesions in the both lobes of the prostate in transverse section, it can be a liver abscess, a prostatic abscess can be one possibility. Now let's study it in longitudinal section. This was the transverse, and in longitudinal section, this is the longitudinal section. First of all, see that the prostatic, you see again, you here the same focal lesion in one lobe. This is the focal lesion, totally replaced focal lesion, this one. This measures 40 into 37 millimeters, 40 millimeters into 37 millimeters, and the other one this measures, this one 31 into 23 millimeters. So you see one of them is here, the other is this one. You can make out both of them. Let's see the urethra. This is the urethra, prostatic urethra, and the important thing to note is that the periprostatic fat line is intact. This is the prostate, this is the prostatic urethra, or no, this is a shadowing from the echogenic area. You're seeing anteriorly. So this is again a magnified view. Where you are again seeing the same focal lesion filled with internal echoes, thick echogenic internal echoes. None of them is giving posterior wall enhancement. In longitudinal section, this echogenic area is also seen not giving any posterior shadowing of significance. This is in transverse section. Now we will study rest after post-micturition.